Hey there, it's Dr. Garza. Happy Monday. Today I want to go over recommended vaccinations for children, teens, and young adults, particularly those of the age range that we care for in our practice, which is between children age 10 through adults age 25. Vaccinations are something that we review at every visit. We know the importance of them, the effects that they can have in helping keep our patients healthy and also keeping their own families and community healthy. So we follow recommended guidelines that have been recommended and verified and validated by the CDC and the governing body that provides guidelines for vaccinations, as well as the AAP and the AAFP, which are the professional organizations for pediatricians and family physicians. So when I see a patient, many patients have already received their vaccinations from early childhood, and so those are ones that their pediatrician would have given through the infant years and young child years. And then as I start seeing patients at age 10, we review vaccines that are due after age 11. So at the 11 to 12-year-old visit, we have a couple that we recommend. There is a vaccine called Tdap, which is a tetanus booster that includes pertussis, which is whooping cough. We also recommend Menactra, which is a meningitis vaccine. Both of those are required for entrance into 7th grade in the public schools and most private schools as well. And so those are ones we want to make sure that they are updated on before entering 7th grade. We also start the discussion about the Gardasil vaccine, which is the vaccine series to prevent against high-risk forms of HPV. That is something that has a little bit more flexibility with the timing of that series, but we want to start those discussions and recommend having that vaccine series done at younger ages. And then patients are pretty set for a while. Every year we do offer the flu vaccine, and then patients really don't need any other scheduled vaccines until 16. At age 16, there is a second meningitis vaccine that's recommended, and so we want our patients to receive that on time. Every visit we're seeing patients, we're making sure they've been vaccinated on time and as recommended. And again, many of these it's never too late to give, and so we continue the discussions for the Gardasil vaccine, for example, throughout each visit. Then as students are approaching the end of high school and approaching college, we also recommend a meningitis B vaccine. So the meningitis vaccines that are given at 12 and 16 cover certain strains of meningitis, and that vaccine has been very effective in reducing the number of cases of those strains. But what's happened is with time, meningitis B, which is another form of meningitis, has become more prevalent. And so it's now recommended to get a second version of meningitis B before college. That is not required by many colleges, but it has been recommended, and it's something that we like to give in the senior year, even spring or summer of senior year before heading off to college. Of course, patients keep their own records. We have their records for them, and many colleges require certain vaccines before entrance, specifically related to the meningitis vaccine. Then at age 20-21, we'll give another tetanus booster to my patients that I'm seeing through that age range. And so, the vaccines we give here are pretty standard according to the age of the patient. And then sometimes we'll have patients that did not receive complete vaccination in childhood, and so we'll work with them to get them caught up to what is recommended, especially if they need those vaccines for entering college. Many colleges will want to see that they've had their updated MMR, which is measles, mumps, rubella. They may want to see varicella, which is chickenpox. They may request other testing and other proof of immunity, and so we help patients with that. So this is a time, the summer that seniors have graduated high school and are heading off to college, that we can help them in kind of getting things squared away and providing that, the vaccines if they need it, and also the records if they need it in order for their entrance to college, to kind of meet those criteria. So just wanted to hop on and talk about that today, and let you know that that's a big part of what we do. Patients can come to us for those preventive measures that are recommended. And anyway, hope to see you soon.